Hey everybody, Dr. Regier from Vet Triage. Sunday, January 12th, 2025, 9:32 a.m. Pacific time. We are a little bit over halfway through this October 2024 edition of Veterinary Surgery, and we're going to be talking about a study here: linear and discrete foreign bodies, small intestinal obstruction outcomes, complication, risk factors, and the incision red rubber catheter technique success. This is in cats. It comes out of University of Florida. The objective: to compare survival and report perioperative complications in cats undergoing surgery for small intestine linear and discrete foreign body obstructions, to report success of a red rubber catheter technique to remove linear foreign bodies. So linear foreign bodies are things like string or yarn. And then discrete are anything that's not linear. So like a rock, or they have a toy in there or something like that. Okay, this is a retrospective study, 169 cats between 2012 and 2023. Results: preoperative hypoalbuminemia, which is low albumin. A lot of studies look at low albumin because albumin and protein levels may be associated with how well the animal heals. Obviously, you need protein to heal. So that's why they look at preoperative hypoalbuminemia and also septic peritonitis. Both these things were rare. Intraoperative hypotension did not differ between them. The red rubber catheter technique was successful in 20 out of 24 attempts for linear foreign body removal. 3 cats were euthanized during surgery. Postoperatively, 2 cats, and they were discrete foreign bodies, experienced intestinal dehiscence, and 2 other cats, also discrete foreign bodies, died or were euthanized. Survival to discharge and post-op complications did not differ. They determined that the red rubber catheter technique can be considered to remove linear foreign body obstructions when there is concern for multiple enterotomies. Introduction: the red rubber catheter technique, which, by the way, I think is the first time I've heard of it, or at least if I did hear about it before, I've forgotten about it. So this is an interesting technique. With a single enterotomy, has been evaluated in a cadaver model and 3 feline cases as a method to remove linear foreign body obstructions while decreasing the number of enterotomies and aforementioned risks. One case report depicted failure of this technique due to embedment of the linear foreign body within the small intestine. Materials and methods. Preoperative septic peritonitis is defined as the presence of intracellular bacteria and abdominal fluid cytology or growth on culture, or if non-iatrogenic perforations were identified on immediate abdominal explore. Hypotension was blood pressure less than 90 millimeters of mercury systolic and or less than 60 mean. The red rubber technique was defined as use of a red rubber catheter with the goal of advancing the linear foreign body through the intestine for removal through the anus, gastrotomy, and or 1 or more enterotomies, while minimizing the number of anticipated enterotomies and avoiding intestinal resection and anastomosis. And the drawing there, I have an example of an intestinal resection anastomosis when you have luminal disparity. There are several techniques you can use for correcting for luminal disparity, and so that's one option there, where you cut out a triangle-shaped piece of the smaller intestine, and when you start to close it, you can close it starting there on the picture below it, and it'll enlarge the lumen of that smaller intestine to make up for that disparity. The red rubber technique failure was defined as inability to advance linear foreign body due to embedment of the linear foreign body within the intestinal wall, or if the intestine was unable to be preserved, meaning euthanasia or resection anastomosis was deemed necessary due to perforations or intestinal non-viability after foreign body removal with the red rubber. Perforations were characterized as perforations observed either before foreign body removal and after foreign body removal, meaning no perforations were present at initial abdominal exploratory, but only observed after the foreign body was removed. Minor complications occurred when cats did not require additional surgery and or did not lead to death or euthanasia within 2 weeks of surgery. Hypothermia was less than 99 degrees Fahrenheit. Hyperthermia, or fever, temperature over 103. Major complications occurred when cats required additional surgery and or death or euthanasia occurred within 2 weeks of surgery. Post-op intestinal dehiscence was defined as the presence of abdominal intracellular bacteria on cytology or visualization of dehiscence during reoperation. The results. Linear foreign body obstructions were the second most common after discrete, and then both was least common. Most common breed was domestic Shorthair. Cats with linear foreign bodies tend to be younger, and they also had shorter durations of clinical signs before surgery than cats with discrete. Owners were aware of foreign body ingestion in 42 instances and had increased awareness for linear foreign body compared with discrete. Resection anastomosis were performed in 8 cats and did not differ between cats with linear and discrete. 2 cats underwent resection anastomosis using gastrointestinal anastomosis and thoracic abdominal staplers, and endovascular gastrointestinal anastomosis and thoracic abdominal staplers. The remaining 6 cats underwent hand-sewn anastomosis. Hypotension occurred in 59 cats, with no difference between them. Cats with linear foreign bodies had longer surgical times. Adhesions were found to be rare. Anchor points. So anchor points are where the linear foreign body gets stuck in the animal. So when it gets stuck, it causes the plication of the intestines. And that's when you end up getting the perforations and partial obstructions, things like that. Anchor points include the stomach was most common, followed by the tongue, and then jejunum, then duodenum, then ileum. Anchor point location in the stomach was more frequent compared to duodenum, jejunum, and ileum, but did not differ between tongue. Additionally, tongue was increased compared to ileum. Cats undergoing red rubber, which is 24, were characterized as successful in 20 of them. Causes for unsuccessful include tissue engagement for the linear foreign body and inability to preserve intestine due to presence of perforations or non-viability leading to resection and anastomosis. Cats with red rubber failure had a higher median duration of clinical signs prior to surgery than cats with red rubber success. That's interesting because that may mean that the more time has passed with the foreign body in there, the more risk it has of embedding itself into the tissues and creating damage to the tissues, making the red rubber technique less successful. Intestinal perforation identified before foreign body surgery was observed in 4 cats. A leak test was performed in 61 cats. A mental patch performed in 65 cats. 3 cats were euthanized intraoperatively. 2 cats due to perforations. 1 was linear, 1 was both. And 1 cat, which is discrete, with severe concurrent esophageal trauma and incidental gastric foreign bodies. I don't know why they would call, in that case, gastric foreign bodies incidental, because if there's esophageal trauma and there's gastric foreign bodies, it's probably because the gastric foreign bodies caused the esophageal trauma on the way down to the stomach. So that's a weird way of phrasing it. Unless they're characterizing incidental, meaning it wasn't the primary cause of why they were euthanized, but that's weird. And then also to comment on the omental patch statement, I do as both a serosal patch and an omental patch on all of the intestinal surgery, whether it's enterotomy or resection anastomosis. I think that it markedly improves the healing and especially minimizes risk of dehiscence if you have a really severe intestinal RNA with fairly unhealthy intestine. 30.2% of cats had postoperative complications with no difference between linear and discrete. Minor complications was 34 cats, most often due to fever within 25 cats and hypothermia 14 cats. Others included surgical site infection, regurgitation, aspiration, pneumonia, and vomiting. When you remove body temperature as a complication, only 7.9% of cats had minor complications. Major included 4 cats with discrete foreign bodies, euthanasia, arrest, and intestinal dehiscence. Dehiscence occurred in 2 cats with discrete, 3 and 4 days after surgery, but this did not differ between cats with linear foreign bodies and discrete foreign bodies. A total of 164 cats, so 98.2% of linear, 97% of discrete, 92.3% with both, survived to discharge with an overall 97% survival rate. Survival did not differ between them. Of the 164 cats that survived to discharge, hospital duration did not differ between them. Discussion. 59.8% of discrete, 32.5% were linear, and 7.7% were both. A red rubber was successful in most cats with linear foreign bodies. Historically, 0% dehiscence has been reported in cats after enterotomy or resection anastomosis. Dogs with intestinal dehiscence range from 0 to 16%. Factors in dogs include preoperative peritonitis, preoperative hypoalbuminemia, meaning less than 2.5 grams per deciliter, intraoperative peritonitis, intraoperative hypotension, location of anastomosis, and possibly the presence of inflammatory bowel disease preoperatively. Only 6 cats had low albumin, 3.6% in this study. Preoperative septic peritonitis, diagnosed in 13.5% of cats, was reported to have a 6.7 times higher odds of mortality than cats without preoperative septic peritonitis, whereas intraoperative hypotension and preoperative low albumin did not achieve significance as a risk factor for mortality in other studies. Septic peritonitis has also been identified in dogs with a risk factor for mortality with a 60% mortality rate. In this study, half of the dogs died or were euthanized within 1 day of diagnosis and never underwent surgery, while the remaining half were euthanized after surgery. In this study, 4 cats, 2.4%, with linear material, 2 cats, 2 with linear and 2 with both, had preoperative septic peritonitis using the same definition as prior. Survival to discharge was not different between the cats with linear, which is 98.2%, discrete, 97%. Linear foreign body survival to discharge was slightly higher than previously reported survival of 84% and 92%, but similar to a report of 100% of cats. Our discrete survival to discharge was similar to 2 other reports of 100% survival. In addition, a significantly lower survival rate in cats with linear foreign bodies, 63%, were reported to have higher levels of mortality associated with longer durations of clinical signs, presence of linear foreign bodies, and multiple intestinal procedures. In contrast, cats in our study with linear foreign bodies had a shorter duration of clinical signs than cats with discrete. In the aforementioned study, owners were aware of foreign body ingestion in 25% of foreign body cases when grouping dogs and cats together. In this study, owners were also aware of foreign body in 24.9% of all cats. However, owners were aware of foreign body ingestion in 38.2% of cats with linear foreign body ingestion. Intraoperative euthanasia was similar between the cats. In this study, they used the red rubber technique through manipulation of a gastrotomy, the anus, or through enterotomies to decrease the number of enterotomies performed. Limitation of the red rubber technique is potential for iatrogenic perforations due to manipulation of the red rubber catheter, which has been reported in a cat with linear foreign body obstruction. If this occurs, a resection anastomosis may be necessary, or an attempt at the red rubber technique may be beneficial before condemning the intestines. Longer duration of clinical signs could increase the risk of linear foreign bodies becoming embedded within tissue. That's what I said before with that. Regardless, the red rubber technique described in our study was successful in 83.3% of linear foreign body obstructions. And that's it. That's the study. So not too bad. As usual, we want more cats, but 169 is pretty good. It would be nice if they were able to have all of the medical records available for all of the cases, which was not the case here, but that's the best they can do. And it was surprising me because cat linear foreign bodies is so common. You would think they can maybe just, I don't know, even if you lowered the number of cases, but you improved the medical record, upkeep it'd be better. But all right, that's it for today. Thanks everybody for subscribing and following. I will see you again tomorrow. Take care.